Welcome to the Nurse Edu Network. My name is Janae. In this video, I will review practice test questions for Domain 2, Facilitate Learner Development and Socialization for the Certified Nurse Educator exam. Which learning strategy involves the affective domain? A. Reflect on personal biases regarding patients from diverse backgrounds. B. Describe side effects of calcium channel blockers. C. Assemble the needed supplies to change an ostomy dressing. D. Demonstrate aseptic technique when drawing up insulin. The answer is A. Reflect on personal biases regarding patients from diverse backgrounds. The affective domain is also known as a feeling domain. It involves emotions, interests, beliefs, attitudes, and values. B is from the cognitive domain, and C and D are from the psychomotor domain. Which learning style solves problems using deductive reasoning? A. Converger. B. Assimilator. C. Accommodator. D. Diverger. The answer is A. The Converger. They prefer to solve problems with deductive reasoning. They prefer structure and facts, technical skills over social issues. They learn best with demonstrations, handouts, and diagrams. They do well in positions such as technology. Learning activities should include problem solving, experimentation, or simulation. All of the following are true about students with previous education except they tend to be more self-directed. B, prefer to have an active role in learning. C, they connect new knowledge with previous experiences. D, they prefer structured learning and activities. The answer is D, provide structured learning. Adult learners with previous education tend to be more independent and prefer self-directed learning strategies. What learning activity would interest students that are divergers? A, watching a video on ethical dilemmas in nursing and then having a group discussion. B, listening to a lecture on nursing theory. C, completing the assigned reading in the textbook on pulmonary disease. D, completing a simulation on a patient that is septic. The answer is A, watching a video on ethical dilemmas in nursing and then having a group discussion. Divergers view situations from different viewpoints. They like to observe, gather information, and then take action. They are sensitive to feelings and enjoy learning in groups. All of the following are learning strategies that convergers prefer except A, demonstration, B, lecture, C, simulation, D, handouts. The answer is B, lecture. Convergers prefer learning strategies that involve problem solving, experimentation, or simulation. Which learning style prefers self-instruction? A, converger, B, assimilator, C, accommodator, D, diverger. The answer is B, assimilator. Their learning preference is lecture, one-on-one instruction, reading, and self-instruction. Which learning domain requires the integration of all of the domains? A, psychomotor, B, affective, C, cognitive, D, none of the above. The answer is A, psychomotor, because the affective domain recognizes the value of what is being learned, and the cognitive domain includes knowing the principles, relationships, and processes involved in the skill. The student is preparing to suction a patient. What question by the nurse educator would involve the affective domain? A. How do you feel about performing the skill? B. Can you show me what supplies you will need? C. What are the rationales for suctioning a patient? D. What are the steps in suctioning a patient? The answer is A. How do you feel about performing the skill? The affective domain involves the feelings, attitudes, and values of the student. All of the following are ways for new nurses to socialize into the role of a nurse except A. Reflecting on personal values and beliefs, B. Reviewing the ANA Code of Ethics, C. Assigning new nurses to a mentor, D. Giving new nurses the same number of patients as seasoned nurses. The answer is D. Giving new nurses the same amount of patients as seasoned nurses. When new nurses first start, it is best to gradually increase the number of patients that they receive as they become more comfortable in their new role. Overworking new nurses can lead to burnout. Domains of learning are used for all of the following except A. Guiding objectives, B. Choosing teaching and learning strategies, C. Grading rubric, D. Planning assessments. The answer is C. Grading rubric. Domains of learning are used for guiding objectives, choosing teaching and learning strategies, and planning assessments. For this presentation, I used Chapter 2 of Caputi. In the next presentation, I will review Domain 3, use assessment and evaluation strategies.